Level 5 Diploma in Leadership for Health and Social Care and Children and Young People's Services. Unit 5, Work in Partnership in Health and Social Care or Children and Young People's Settings. Enhanced Limited Copyright 2019. What is a working partnership? A partnership works together and coordinates smoothly through development, acknowledging that it may be impossible, in certain situations, for one person to care for a service user alone. New organizational structures should be created to ensure that healthcare professionals can work in partnership with one another. Working in partnerships can be integral to the way local authorities have developed community strategies and partners. Joint work with other health professionals is paramount if the service user is to receive the best care. What are the features of partnership working? Working effectively as a partnership requires certain features to ensure its integrity. These features are: a joint agreement that ensures that the service user is the central figure. This ensures that everything is done within the service user's best interest regardless of personal differences within the partnership. Good communication. Strong leadership. Resources. Trust shared between partners. Health and Social Care Act, 2002. This brought new structures and working agreements in for the NHS. One significant change that came with this act was more integrated care work through partnerships and HWBs, health and well-being boards. It streamlined healthcare services with the intent to reduce costs and elevate the standard of care received by service users. The importance of partnerships. Partnership working has improved the quality of offered services. It has been proven that it is more cost-effective. Through common goals and a whole-person approach, mutual respect between healthcare professional and healthcare professional has been established. This way of working has benefits for all involved in healthcare. For service users, it has greatly increased their quality of care. It has created a more joined-up approach to care. Having a single assessment process has helped to unify assessments and improve evaluations. Through common goals and a whole-person approach, mutual respect between service user and healthcare professional has been built upon. Improving outcomes. Since the Health and Social Care Act 2012, there have been many seen improvements through using the partnership's working strategy. Some of these improvements are: trust and mutual respect. Positive approaches that are constructive. Honesty, transparency and openness. Commitment to work and continued development. Learning from other partners and sharing knowledge of processes, practices and technique. Early discussion. Confidentiality when required. Overcoming barriers. Health and social care workers and partners collaborate on 3 different levels: strategic, operational management, individual care. Different professions with different professional backgrounds, cultures and funding home the different healthcare professionals involved. These different professionals as individuals will have different values and beliefs. These differences can cause barriers and conflict. These barriers can be overcome through working together, improved communication systems, engagement with the family of the service user, putting the service user and their interests first, training and CPD. To build and maintain a successful work relationship, it is important to maintain an open mind and approach situations without judgment and prejudice. Keep the service user as the main concern/focus, therefore all actions made should be to benefit the service user. Maintain an environment that promotes national policies. Conflict can arise at any time during a partnership and should not always be viewed as negative. Sometimes conflict can be positive. It can highlight important issues being faced, and it can also cause change and positive cycles that lead to better outcomes. Factors that cause conflict: lack of understanding, lack of clarity, organizational differences, budget, communication, information sharing, managerial support, or lack thereof, differing philosophies, lack of trust, role boundaries, staff recruitment. The following are ways procedures can be developed within a healthcare organization: identify a mentor, provide carer awareness training, develop links to other carers organizations locally, start up a staff carers network, make sure information for carers is available and well publicized, involve carers in service planning and development, provide training for CPD to enhance knowledge and understanding through improvement to best practice and procedures. If you would like to cite this presentation in your work, please use the citation template below.